hard to see that it's...
Welcome to Labor's View. My name is David Weiner, and I'm president of Local 1081 of the Communications Workers of America. We are the union that represents the non-supervisory employees of the Essex County Division of Welfare. And again, I'm the host of the show. We are going to talk about our agency, the Division of Welfare, where 1 out of 5 citizens, residents of the County of Essex are serviced by the Essex County Division of Welfare. People may not believe that or want to believe it, but it's true. And that means it's not just people in the urban areas, it's people in the suburban areas that if you want to go towards Nutley and Belleville, you want to call them suburbs. You want to go up west beyond South Orange, West Orange, Roseland, Verona, everywhere. We have clients either of various programs that we have. Aid to families with dependent children, which is now called TANF. Food stamps, Medicaid is big, especially for senior citizens. So we're going to tell you, I'm going to tell you, because there's nobody else here, about some of the issues that we've had of late. Some actually, usually I just, being a whiner, my name, I whine about things. And today I'm going to say a few good things, and then I'll start whining again that happened. The first thing that happened was a big one. The U.S. Supreme Court recently ruled that the ACA or Obamacare is absolutely legal all across the nation. Had they ruled differently, I believe some 7+ million people would automatically have been denied access to the supplemental funding that they receive for their insurance under the ACA or Obamacare. So that's a really big one for everybody in society, including it affects our members because we take Medicaid applications and therefore we're involved in that. Also, we've been lobbying our union, the Essex County Freeholder Board, about the conditions of which I've spoken many times as of late, actually since December of 14, this being July 1st actually of 15. And that is the fact that the County of Essex, supposedly at the behest of the state of New Jersey Department of Human Services, decided to put all of the county welfare agencies except 2, it's interesting, have to do something called case banking. And that very simply means that instead of having one worker, one client, that the client will go into an agency and it's like an assembly line. One person may see you for this, another for this, and if someone else isn't there the next day, the materials you gave the first worker very well can and will be lost, so you have to come in multiple times, causing lines of people, lines of humanity suffering, sitting in a waiting room which is overfilled for capacity for a fire department, into the lobby and then all the way up to the stairs. And this is the privately owned 18 Rector Street building in Newark, where our agency rents now the entire edifice. So case banking, just to be clear, has nothing to do with banking in the traditional sense. It means that the information that the clients give us is supposedly inputted into a computer system, and at the same time some small folders are kept in what they call a bank or a room where it's a file room. It's a fancy way. But instead of you're coming in and you see me, Mr. Weiner, I'm your caseworker, and whenever you have changes throughout the course of whatever length of time you're receiving health benefits, whether it be TANF, like I said, which is welfare for women and children or men and children, food stamps, Medicaid, whatever, you'll see me, and you'll see me month after month. And when I have to do what's known as a redetermination, which is check your circumstances twice a year, meaning you have to show that you're still living in the same place, your income's the same, your family size is the same, so that there be no change to the amount of funding, the little bit that we do give, which hasn't been changed, by the way. The amount of welfare grants have not been changed since 1987. So that just shows you how we're keeping up with inflation. So instead of seeing me, and instead of knowing that you'll see me down the line, you'll see somebody else each and every time, and it's a complete and utter mess. So what we did is on May 20th, we did a mass demonstration at the Freeholder Board at their regular meeting, which I believe was our last show, wasn't it, Jerry?
Yes.
It was our last show, and this show. And we told them what was going on, even though we had told them before, and we urged their two committees to meet. The Freeholder Board it's the legislative branch of government. You get the county executive, of course, then you have the judicial. So you have really the two run the government, supposedly, the county executive and the freeholders. It's really the former. But the freeholders have about 19 subcommittees that mirror what the county administration does. So you have parks, well, there's a parks committee. You got the stupid zoo, you got a stupid zoo committee, et cetera, et cetera, et cetera. So there are two committees that are of importance to us in terms of what we do. One is the labor committee, and the other one would be the welfare to work committee, the latter being even more important. So the labor committee met, chaired by Freeholder Richardson, who was one of the only freeholders who was nice enough to accept my invitation to come to 18 Rector Street about a month or so ago, and he had a very bad cold, and he showed up, and he actually went through the 18 Rector Street Klein entrance, which is a ramp that goes through all kinds of security apparatus. You got to take virtually everything off to get through it. He did that. He had no problem. Went to the third floor, which is the worst floor of all in terms of crowds, the West Side office, it's called, and he spoke to my counterpart, who's the manager of the West Side office and also president of the Supervisors Union. So we thank Freeholder Richardson again for that. His meeting was good. His labor committee meeting was good. We got a lot of things out on the table. Then about a week later, the welfare to work committee meeting was held, and that's chaired by Freeholder Toro, who's is a new freeholder, as is Freeholder Richardson, as is Freeholder Timberlake, who's the president of the Freeholder Board, who at 28 was elected president of the Freeholder Board in her first term. Both Timberlake and Toro have social service backgrounds, so we would hope and think that they'd be somewhat more sensitive to what the issues are that we're complaining about, which is too few employees, a case banking system that doesn't work, that causes clients to wait for hours outside the offices, inside the offices to be seen, and then we need more space, and that's another issue. We even identified space at the YMCA, the entire third floor, but no one's listening so far. So the Welfare to Work Committee met as well, and it was a good meeting. And in fact, as a result of that, tomorrow evening, a friend of ours, our union, who works for a long-time lawyer for Newark Legal Services, Rick Ford, he and I are meeting with Freeholder Toro in Bloomfield tomorrow evening to discuss our concerns even further. So I'm glad that she's following up in that respect. Also, a bad thing that occurred, but we knew it was going to happen to our members because it's happened to all government employees, state, local meaning county and city in New Jersey. As a result of the legislation I've spoken about in the past, it's called Chapter 78, which was passed in 2011 and signed by the governor. As a result of that, our pensions went up 2%, 1% right away in 2011, and 1% split up over 7 years. Well, the last split hit us this July 1st, so we went from about 6.80% of our salary up to about 7.2%, and it'll keep on going up until that full sevenths are completed. We also have a good thing to report, and that is, for years we've been trying to get in the lobby of 18 Rector Street. When you come in on the 18 Rector Street side, which is the side of the building is really 10 Park Place. It's right across from the YMCA. It's got big columns in front of it. It's right next to the PAC, so New Jersey Performing Arts Center, so I'm sure many people have seen the building as they've walked past it to go to the Art Center. Well, we've been pushing for at least 15 years for them to change management, to change the way the configuration is on the elevators in the morning, because the clients and the workers up till now have had to use the same elevators in the morning hours between 7:30 and 9:30. So therefore, the clients obviously, and I don't blame them, are in a rush to get up to the floor so they can get their slip, and be one of the first seen. The problem is, if they get the elevators and the workers don't get up there, they're not going to be seen at all because the workers are not there to interview them. Plus, the workers are marked down as being late. So we finally got the administration to agree, this administration, to agree to set up for those 2 hours 2 elevators dedicated only to employees so they can get up there on time, set up, and be ready for the clients when they come upstairs. May not seem like a big deal to you guys, but to us, it's a huge deal. That's the elevator accommodation for the staff. We also had recently our CWA National Convention in lovely downtown Detroit, and I don't say that disparagingly. I was scheduled to go, but with 2 of our members, the members are elected, the chair automatically goes. And it's held every 2 years. And the only reason I was going to go at all, because I've been to about 30 out of 35 of them, and I haven't gone to a lot of them recently, is because they had the elections for our president of the national and all the big shots and the vice presidents and stuff. And it turned out to be a big, interesting event because all the computers went down, so they had to do all the counts by hand. It took about 6-7 hours, I'm told. Luckily, I didn't go because the Friday before the Saturday I was to have left, I got a word from freeholder Toro that her Welfare to Work Committee meeting was going to be on that Monday. So obviously I couldn't go to Detroit on Saturday, stay one Sunday, and then come home that night or come home Monday. It would have made no sense whatsoever. So I had an excellent reason not to go to the convention. But those who did go enjoyed themselves and learned a great deal. Another good thing, I know it sounds strange to anybody who's watched the show that you see I'm not complaining all the time. I will in a little while, but another good thing that happened is that, well, the bad thing first happened. Our Deputy Director of the Department of Citizen Services, Lucia Guarini, decided before our former division director, Sharon Butler, retired, which was about 6-7 months ago, that all of a sudden our minor disciplinary hearings, which means it's a suspension of 1 to 5 days, that we weren't going to have hearings for them anymore. No hearings. I couldn't ask for discovery, meaning all the documents and names of witnesses, and they weren't going to hold a hearing. They were just going to suspend the people, and that was it. The problem we have with that is that there's only 2 ways to appeal disciplines, and with a major discipline of 6-day suspension all the way to termination, you can go to civil service, and that's remanded to the Office of Administrative Law, where you go before a judge. I go before a judge representing the member. But with minors, you can't go to civil service. You have to go to arbitration, and that's very costly and very time-consuming. Fortunately, we did some things that directly or indirectly influenced the administration to resume those hearings, and in fact, we have one scheduled for next week. So that's a good thing. Possibly disruptive thing can be that all our email addresses are going to be changed supposedly today, but it's not happening today. It never happens when they say it's going to happen. But the email addresses that we have now are linked to the state. They all have DHS and state and New Jersey and US at the end of them. These are going to be proprietary. They're going to be inside just the Division of Welfare email addresses, which I had to do an OPRA request, Open Public Records Act request, to the county to get a list of all of them, because that's how I communicate with our members other than when I see them in person. So we're waiting to get those addresses, and then for those addresses to be started to be used. And they're being used in conjunction with a program called SharePoint, or 365. It's a Microsoft program, software. And basically what it does is when a client comes in, the clerk in the reception area types in the information, it comes out of a printer, into the computer, comes out of a printer, in 3 parts. You give one to the client, one to the worker, and one for the little girl down the lane. I don't know who the other one's for. But anyway, that system doesn't always work. It's sometimes down, but this new email system is going to be hooked into this SharePoint 365. So it's going to be interesting. Now, of course, not everybody in our agency has been trained on SharePoint 365, but they're all expected to use it as of this month, which is just typical of the way the Division of Welfare has worked for many, many, many years. There was an interesting thing that we grieved, and we also had to do an Oprah request about this. That's because we've been telling you, excuse me, what's that guy, Rubio? I'm going to do a Rubio. And then I'll take my time. The governor of Florida. Because we're so backed up on Medicaid cases, as of, let's see, the middle of June, the downtown office, which is an Medicaid intake office, had 50,000 overdue Medicaid redeterminations. That means when you, like I said before, when you recheck the circumstances of a client to make sure they haven't changed, they had 50,000. As did the West Side office, which is the only TANF office we have for mothers and children. They're now down to 35,000. I don't know what the 10th floor has. So we have crowds constantly with all the changes they did. They even shut the agency down for a day and a half. And I grieved it, saying it was a dumb thing to do, but they didn't shut it down for the workers. They shut it down so clients couldn't come in. It was on a Friday afternoon about 3 weeks ago, and then an entire Friday about 2 weeks ago, so that workers could just do processing. Because we keep taking applications, but we don't have time to process the cases. So in order for the cases to get on the system, they've got to be processed. But unfortunately, that didn't work. So what they tried again, in order to rob Peter to pay Paul, really, is they took people that are family service workers, which is like a social worker. They're our members. They're assigned to one or each, I believe, is assigned to the major hospitals in the area. Barnabas, Mountainside, St. Michael's, Beth Israel. So what the worker does is they sit there and they take Medicaid applications from people coming into the hospital for assistance. It helps the hospital because the hospital makes sure they get paid. If the person doesn't have any medical coverage, they can sign up for Medicaid, and if they're deemed eligible, the hospital will get reimbursed for whatever services. So what the geniuses in management decided to do in our agency, and they're relatively new geniuses, they took over on April 6th, they said, okay, we're going to take these Medicaid outstation workers, and for a while we're going to reassign them to the 18 Rector Street building so they can do the same kind of write up the cases, finish the cases of the Medicaid. Problem is, the hospitals are paying 50% of the salary and benefits of those employees for them to be there. The feds are paying for the other 50%. So my question is the county, or did the county, if they're still doing it, cheat the hospitals out of the services that these people are supposed to be providing, while the hospital and or the feds, because that's the 50-50 split, did they pay for a service that wasn't there? That's something we're asking. Another concern of ours is something we've always said is a concern of public employees, is privatization. Privatization means you take something done by a public employee and you give it to a nonprofit or a for-profit company to do instead. Most of the time, the reasons to do that, one, they allegedly save money. They really don't. What happens is these companies, whether they're private or nonprofit, they lowball in the beginning. They give you a lower price, so you're saving money. Eventually, the price goes up and up and up, and eventually exceeds, almost invariably exceeds what the original cost was for the employees to do it, plus it's poor quality, and very often they have to go back to having employees do the work. Well, since we have so many Medicaid cases to do, the county, by order of the state, the County of Essex Division of Welfare, by order of the state of New Jersey, as are, I'm told, all the other counties, who have a huge Medicaid backlogs, which are most of them, have been told to give thousands of these cases to a company called Xerox. I'm sure you've heard of them. They make copiers and they do all kinds of other stuff. In fact, their office, ironically, is a floor above this union office. And so they gave them about 6,000 of ours, 8,000 of Bergen County's last year. Now, they don't see clients because they only hired an additional 124 people statewide. So they're not seeing the clients. And we know the clients are coming through this building to go to the 6th floor above us because we know we don't see them come in. They got to be checked in. So what all they're doing is Xerox is just doing technical changes to the documents to bring them up to date. Our problem is that could begin a slippery slope of trying to give a company like Xerox Medicaid to do. Problem with Xerox is they've been thrown out of at least 2 or 3 states already for not doing the job for Medicaid, as have other companies such as IBM and others that were thrown out of states or counties or wherever doing it because it turned out that their work was deficient. Plus, the difference is you can't do an Oprah request to a nonprofit or for-profit because it's not governmental. All you can do at Oprah again is to get information, to get documents, not information, but to get documents to give you information. So if I did one about the changes with the Medicaid outstation, but I had to do it to the county about their contracts with the hospitals, which I have. I have all the information. In fact, I just wrote a grievance yesterday and included one of the contracts that happened to be with Mountainside, which has no way does it say in any way that allows the county to take away an employee for any period of time to do something else for the county and not do the Medicaid for the hospital. So the Xerox thing is interesting, it's big, and we're keeping a really good close eye on it. Now our new director, I don't know what Jeanette Page Hawkins, she has a new title they gave her, the administration. I refuse to use it because forever, since the beginning, I believe, of the Division of Welfare, which goes back to the 30s, and we were called something else, old age, whatever. The director and the deputy director, when there has been a deputy director, have both been covered by civil service. And that's to protect them against being unduly influenced by whatever the administration is to do things that they shouldn't be doing. Well, when Ms. Page Hawkins came in, and she came in from the state of New Jersey as the head of the Division of Family Development, which is under the Department of Human Services. And the DFD, the Division of Family Development, is over all of the welfare agencies in the county and all the counties in the state of New Jersey. So therefore, this case banking that's so bad and many other changes and issues, such as the state allowing the County of Essex not to abide by an annual agreement to have a minimum number of staff for 1 year, they did it out of 12. They abided by it. 1 year. All those other years, the state allowed them not to do it. Well, Ms. Page Hawkins was the director up until April 3rd of the Division of Family Development. Then she comes to us on April 6th, and she's our director. I call her the acting director of Division of Welfare because that should be her title. I don't know what other title they gave her. But regardless, she has a suggestion box. Well, I'll tell you what happened with this suggestion box. Somebody wrote a suggestion, a lengthy one, emailed it to her, to her address, and they began, and they put their name on it. But by the time we saw it, the name had been redacted, just crossed out. And it basically dropped a dime either for actual or unrealized or made up things about their coworkers, saying people aren't working up to their potential, the person in front of her is sleeping, people should be disciplined. And this is a union member, this is somebody that we represent. I have a good feeling who it is, but I'm not going to say because I don't know, although I did do an Open Public Records Act request, OPRA, to the county for the unredacted document, which so far they're denying me, saying it's some kind of work product. But I'm going to appeal that to the Government Relations Council. Eventually I'll get it. And it's not for retribution. We just want to let our members know that you don't go to management and snitch to management on your co-workers. If you have issues, you come to us first, and the union, and we try to work it out. Because very often we can and we do work problems out between workers and co-workers. We still have our theme, one client, one worker. And that goes back to my original point about the case banking system. Case banking, you don't have one client, one worker. The client gets whoever they get, whenever they get them, or her. But with one client, one worker, the old system, you know who you are. So we made buttons, we had picket signs, and we took them to the demonstration on May 20th. We've had other good stories. We had a gentleman that had been suspended for 5 months because of an arrest on an issue which was downgraded, and when I was able to get him his job back and with his health benefits, and he actually starts on July 13th. We also have open public records requests going on for the things such as this firm Brightstar, going back to the computers again and the emails. This Brightstar is a nonprofit. They've been given the task by the administration, unbeknownst to us officially, because we don't get told anything by the administration, to look at the email utilization by looking at every single person's email and see how many they responded to or they didn't. We encourage the members to respond to the email because that's how I communicate with them. That's how I said earlier, we've requested all the new email addresses that are coming on. So as you can see, the issues in the divisional welfare, while they may not be, obviously, and probably are very well not of great or any import to you, they really should be. Because you're paying the freight through your taxes, you're paying the freight through the sociological ills that emanate from having a dysfunctional sociological fabric, such as having poor school systems, all mostly located in New Jersey, Essex, about 33%. The school system, the welfare system, the youth house, the jail, it's all interconnected. The problem is we have what they're called silos, and nobody wants to talk to anybody else, and no one's allowed to talk to anyone else. So we have Labor's View, and we talk to you, and we hope you get an understanding that if you or one of your neighbors goes to a divisional welfare office, either in East Orange or in 18 Rector Street, you'll understand that if you have to wait, it's not the fault of the workers, it's the fault of the system, and the union is trying to change it. So on behalf of the members of CWA Local 1081, I thank you for watching Labor's View. I'm David Weiner, and I'll see you again for our future shows. Thanks.
I have a voice, one that can speak for me. I have a say in my own destiny. Here on the job, no, it is not hard to